What if your symptoms look like PCOS but are not? Getting this wrong means every decision after could be off. So let's talk about inclusion versus exclusion criterias in the PCOS diagnosis. I had somebody ask me, like, hey, I had polycystic morphology on my ultrasound. Isn't it super obvious? That is not how the diagnostic process works, and for good reason. So, inclusion criterias. What must be present? Or think of inclusion in what must be in. And I've covered this in 2 previous videos because those criteria change based on the age of diagnosis. So if you're a teen or you were diagnosed as a teen, there's certain criteria you need to meet. If you're 20 and up, there are other criteria you need to meet. So you can go check out those 2 videos. This video, I'm going to talk about exclusions, what must be absent to avoid a misdiagnosis, what cannot be positive. So to be clear, in order to get a PCOS diagnosis, you need to meet your age-appropriate PCOS inclusion criteria and also meet the exclusion criteria, which we're going to talk about today. And this is relevant. Actually, this doesn't change based on your age. The exclusion criteria are the same for everyone, irrespective of your age. So although you may have a different first video, this second video, I'm talking to everyone. So before we call it PCOS, we have to rule out other things that look like it. I call these sometimes mimickers. And they're mimickers because they produce the same symptoms as someone with PCOS. So, some of the most common mimickers are thyroid and prolactin, and those are fairly common and fairly commonly tested. But others are more rare, and these are often the ones that I see often missed. But the PCOS guidelines are very clear. There are mandatory exclusion criteria labs that need to be done for everybody, because if we do not do them, we will miss these rare genetic conditions that look like PCOS but are not PCOS. And those people need to be caught so that we can treat them like they deserve to be treated, not as someone with PCOS. So, thyroid. What do we need to look for in blood work? TSH at diagnosis. Thyroid can cause your cycles to be irregular. So if your cycles are irregular, but it's not because of PCOS, then it might not be PCOS. Second one, prolactin. High levels can block ovulation. And so that also can look like altered menstrual cycles. Third one, 17-OH progesterone. And this screens for a congenital adrenal hyperplasia. FSH kind of checks the brain-ovary connection and communication. So these ones are the mandatory ones. We also have conditional ones that are more like case by case. You don't have to have had these tested to get the PCOS diagnosis if you meet the inclusion and you meet the exclusion. But your healthcare provider should still be thoughtful about this. If you have some extra symptoms that might actually represent something else. Cushing's is something if you have features of cortisol excess, and a lot of those symptoms can look like PCOS. Androgen secreting tumors, if there's rapid or severe androgenic symptoms, or hypothalamic amenorrhea, if you're underweight or you've been over-exercising, or you've been losing weight. As long as there's been a discrepancy between energy in and energy out, that's pretty significant. We can experience hypothalamic amenorrhea, where your body's like, I'm going to chill out on this. So in PCOS, the androgenic symptoms are slow and progressive. If someone has sudden or very severe hair growth, voice changes, these are red flags for maybe a different condition causing high androgens and other red flags, and that needs to be looked at. If somebody presents with a bit of a moon face shape, a buffalo hump at the back, purple lines on their abdomen, those can be some red flags for high cortisol and could be a flag for Cushing. So we might want to do some extra testing there. And if someone has a very low body weight or has been training, having an extreme training schedule or really high stress, they might be missing some periods too. And that might be a red flag for hypothalamic amenorrhea. If somebody has milk discharge and they're not breastfeeding, or headaches and vision changes that are new, then that might be a red flag for prolactin tumor. And so there's some other things that need to be excluded, but we only do that on a case-by-case basis when, there are some of those extra symptoms that we need to consider. So to summarize, inclusion, what needs to be in for you to meet the inclusion part of the diagnostic criteria. That's covered in 2 separate videos, depending on the age of diagnosis. Exclusion criteria, what must be ruled out. So the mandatory labs for everyone, irrespective of age, irrespective of signs or symptoms, is TSH to test your thyroid, prolactin, 17-OH progesterone, and FSH. So check your lab work, see if that was done during the diagnostic process. If it was, and it was all normal, that's great. You met the exclusion criteria. If it was positive, then more nuanced and follow-up needed to be done at that time. Then there are conditional labs, which we're not going to do with everyone. You don't need to meet these if you don't have any extra symptoms and you've met the exclusion criteria. But where we need to be a little bit more cautious are when there are features of excess cortisol. We're going to be screening for Cushing's. When the androgen symptoms are very rapid or severe. So to recap, accountability and mindset, link below or in the bio. Come raise your PCOS IQ with a fabulous group of people. We are growing at such a quick speed. I'm so happy to, it's such a great place of joy for me. So come in and check it out.